morning to introduce Ioana Popescu and Sandy Kosi, presenting to us from the Canadian Patient Safety Institute. A little bit about our presenters. Ioana is Patient Safety Improvement Lead with the Canadian Patient Safety Institute and provides leadership and management to the design, development, execution, and evaluation of CPSI programs, including the Patient Safety and Incident Management Toolkit and Patients for Patient Safety Canada. Nursing and business management are two of the pillars on which she's built her patient safety expertise. And Sandy Kosi is Senior Director with the Canadian Patient Safety Institute and leads strategic national initiatives with the health system, governments, providers, and patients and families to make healthcare safety. Sandy started her career as a practicing physiotherapist in acute care and since then has worked in leadership roles in occupational health and safety, regional and provincial stroke services, and organizational health for a provincial health and welfare trust. She's an executive committee member with the Leadership Division of the Canadian Physiotherapy Association and also instructs patient safety curricula for PT students at the Faculty of Rehabilitation Medicine at the University of Alberta. So with no further ado, I will hand it over to Ioana and Sandy.
Thank you so much, Leanne. It is a pleasure to be here with you and speak to your colleagues. I'm going to begin by providing you a little overview of our presentation. So Sandy is going to speak first about the Canadian Patient Safety Institute, and she's going to link patient safety with your work with physiotherapy. Then I'm going to provide you a little more background on the Incident Management Toolkit and point to a few concepts and toolkit features that I believe would be helpful to you. Then I'm going to mention a little bit about patients as partners and point you to a few resources that we have saved for you at the end. But we would like this webinar to be a conversation. So I would like to begin by asking all of you to tell us in the chat box, where do you work? If you can just type public, private, or any other setting that you work, knowing that will help Sandy and I fine-tune this presentation so it is as helpful as possible to you. So I'm going to pause just a little bit to give you a chance to type so we can see public and community is so far the winner. We still have a few private. Excellent. Great to know. Okay. And also, the second question for you is, what do you want to know from us? I showed you the agenda and our plan for now, but do you have some specific questions for Sandy and I? Or any goals that you have for this presentation? I'm going to leave you with that question, and please think of it and type in the chat box throughout the presentation because we want this to be helpful for you. And now I'm going to turn it over to Sandy to tell you a little bit about the Canadian Patient Safety Institute. Sandy?
Wonderful. Thanks so much, Ioana, and good morning, everybody. So I have the distinct pleasure of letting you know a little bit about the organization that Ioana and I both work for, the work that we do, and as a practicing and former physiotherapist, but still with an active license, I'll let you know a little bit about some of the linkages for physiotherapy practice from my own reflections. So a little bit about our organization. The Canadian Patient Safety Institute was established back in December of 2003, and we're an independent, not-for-profit organization. We're arm's length from government and regulators, funded by Health Canada, and we have a national mandate to build and advance a safer healthcare system for Canadians. We do this by fostering collaboration between governments and stakeholders, and we support the development of patient safety initiatives that will help Canada become the safest healthcare system in the world. We perform a coordinating and leadership role across all health sectors, acute care, community, long-term care, etc., and health systems with all health professionals. We promote leading practices, and we mobilize knowledge for health system leaders, providers, and patients about patient safety. Our mantra, ask, listen, talk. This is not just our tagline. This is an overarching theme for our Canadian Patient Safety Week, which we'll be celebrating across Canada next week. But this mantra also guides everything we do at the Canadian Patient Safety Institute and how we approach every interaction and every partnership with others. So this is how we're also going to approach our presentation with you today. This isn't going to be a lecture. We want this to be a bit of a discussion. So you'll see that we've included a bit of opportunity for some interactivity where you'll be using your chat box, etc. We're not just here to give you information. We're here to talk to you and talk with you about patient safety when things go wrong and what you can do about it. So as you want to mention, I'm here to provide a bit of a link for you between patient safety and physiotherapy. So to get us started, let's get on the same page and let's talk about some definitions. So patient safety, really when we're talking about that, we're referring to unintended harm to a patient. It's related to care or services provided to that patient rather than the patient's underlying medical condition. Harm is a key word, and harm is really an outcome that negatively affects a patient's health and or their quality of life. The preferred term that we use is actually patient safety incident, and you may have heard the term adverse event, which is still a commonly used term, but referring to that diagram on the right-hand side of your screen, when we're talking about adverse events, that's really referring to any healthcare-associated harm. So it includes things like reactions to medications, unknown allergies, things like that that really don't have an element of preventability. But when we're talking about patient safety, we're talking about an event or circumstance, again referring to the definition on your slide, that could have resulted or did result in unnecessary harm to that patient. And unnecessary is a really key word here because there is some element of being able to do something about that. Another term that you'll often hear in patient safety terminology is error. And in Canada here, it's something that we've defined as not necessarily a preferred term. Obviously, it's still relevant and appropriate in certain contexts when we're talking about safety. But this term can really be misleading, especially when we're using it in public settings. When I talk public settings, I mean with the general public. It can be misleading. It can imply that care was substandard or perhaps even negligent, when really we know when we're talking about patient safety and in the terminology that I've outlined for you, patient safety incidents are a combination of factors. They're very rarely attributable to an individual's provider's actions or the decisions that they've made. Yes, sometimes there is judgment or error concerns on that may contribute to a patient safety incident, but certainly it's not the only factor, not the only contributing or causal factor. Error also implies causality, which is why we don't use that again. There's many contributing factors to any type of incidents when something does go wrong. So moving on, whenever you see this little keyboard indicator on your screen, we're going to stop and ask you a question with this question mark box. So we want to get a little bit better understanding about what is your understanding of patient safety. And if you can type in the chat box any examples that you might have witnessed or experienced of patient safety incidents, whether in another practice setting or perhaps related to your own practice. So using the chat box, I'll give you a couple minutes here if you can type in examples of patient safety incidents. So think back to your own practice, maybe things that you might have observed or witnessed, things you might have heard in the media, news headlines. If any of you watch Grey's Anatomy or ER, there's lots of examples even in some of those instances. Great, you're starting to see some answers populate now. So falls. Great, falls is a big recurring theme, especially for us in physiotherapy. There's some more answers coming in. Okay, unplanned extubation in ICU. Great example. Sometimes lines become unplugged when we inadvertently, when we really don't want them to. Okay, sometimes when somebody's legs give out, so it might contribute to a fall or some other harm related to that care. Just give you one more moment here. Keep typing them in as we go throughout the presentation if you'd like. Great, thanks Ivana. That will contribute to your discussion even through the chat box. So just to give us a few more examples, and I'll pop in here with some of my own experiences. Sometimes all too often, we think of unintended outcomes of our care or patient safety incidents. Sometimes these things are just, or we refer to them as, oh, it was just an oops. For physiotherapy, sometimes it's, I left that hot pack on that patient too long and they might have sustained a little bit of a burn. Oops. I misdiagnosed a patient's musculoskeletal injury and provided ineffective or incorrect treatment. It's a bit of an oops. The home care services or equipment that I arranged weren't implemented when that patient was discharged from the hospital that I work in. Oops. Sometimes we think about patient safety incidents as just medical errors or medication incidents, drug errors, things like that. But certainly those things aren't really oopses. They obviously have some element of preventability or actionability. Patient safety incidents aren't just faceless statistics, and they're not just an oops. These are some of the faces of our inspiration. Members of Patients for Patient Safety Canada, which is a patient-led program at the Canadian Patient Safety Institute. These individuals, and this is just a snapshot of a few of those individuals, are patients and family members who have been impacted by harm from unsafe care. And they provide their experiences as individuals, but also as a collective and credible voice for patient safety improvement at all system levels. We have more than 70 members across the country, and they have personal stories of heartache and loss, grief and frustration from the healthcare system. As I mentioned, many of those have been harmed themselves or who have lost loved ones to harm from healthcare. But yet they're all far enough along through their healing trajectory that they're able to look beyond their personal events, draw from their own understanding, and collaborate with the health system at all levels. Why I'm stopping here and bringing this perspective into our discussion? Because nothing equalizes our conversation like the patient voice. This is why we do the work that we do across any healthcare setting. And certainly our healthcare is about empathy, and this is something that as rehabilitation professionals and as physios, we know this concept really, really well. But one thing I wanted to share with you from a personal reflection is that I will tell you that you can, and you likely will, contribute in some way to unsafe care for the patients, clients, and residents for whom you intend to do your very best. I know that I have. You may have already. You may have your own experiences, whether as a provider, as a family member, as a caregiver, or even as a citizen. I know that I can remember every name, every face, every diagnosis of every patient that I have ever inadvertently harmed. But really, don't get me wrong, I'm not a bad therapist. I'm no different than any of you. I was an extremely good therapist. Let me tell you a little bit about one of those individuals that I remember really well. And I can visualize her even. So Mrs. M, she was admitted to the acute care hospital that I was working, and she was a really sweet little lady, 86 years old. 86 years young, I would actually say, because she had such a youthful spirit. And she was living in an assisted living facility. And I was working on internal medicine at that time. She was admitted with a diagnosis of community-acquired pneumonia. And like most individuals her age, she did have some mobility concerns, which perhaps was compounded a little bit by her physique and stature. She was probably all of about 4'10", and almost just as wide around with her circumference and her girth. Just a sweet, rotund little lady, which made transfers and mobility difficult, as you can imagine, especially with her breathlessness. But despite my best efforts to document and communicate her transfer and positioning needs to other members of the care team on that unit, she sustained a fall during an unsupported transfer, and she fractured her hip. So she ended up having surgery, transferred to the orthopedic unit, and unfortunately she had a prolonged bed rest, and she did get transferred back to our unit, which contributed to a stage 4 sacral pressure ulcer. This pressure ulcer contributed to a sepsis, a systemic sepsis, both of which were major factors in her death. This was not just an oops. When we're talking about these experiences, patient safety is not just medical error. We're not talking about professional incompetence, and we're not talking about somebody else's problem. We all have a role in patient safety. So again, just some of the issues specifically to physiotherapy practice. We know healthcare, and you will know healthcare is incredibly complex and it's incredibly complicated. Yet our healthcare system doesn't always support safe practice environments, especially related to transitions in care. And it often doesn't facilitate opportunities to learn from when something does go wrong. So as rehab care providers, sometimes even our own professional values and philosophy are at odds with the essential tenets of patient safety and quality. Our role as physiotherapists is to optimize the health, well-being, and quality of life of the patients, clients, and residents we serve. Yet sometimes our best care is to support a patient's right to live at risk. And we know this as rehab professionals in different care settings, in all of our care settings that physiotherapists work in. We know safety is sometimes not always within our control. So why is this important to physiotherapy practice? And the reality is that one incident, whether it's a high-profile public incident or even something that impacts your own professional practice, could radically change your perspective, or even the public and your patient's perspectives in our own profession, in our own professional practice. And we'll highlight some of the resources available to you from Physiotherapy Alberta later on in our presentation. So I also reflected that we have some unique skills as physiotherapists in assessing safety risks. We do this all the time, and we put things in place to prevent the errors of others and to optimize the safety and well-being of the clients that we serve. And in many circumstances, we see patients more often than anybody else does on the care team, whether that's in a community setting or if it's in a facility level setting. And oftentimes we'll notice those little subtle changes and receive more frequent communication with that patient and the family member. We often act as advocates and we communicate those changes and safety concerns or safety risks. But what I also want to share with you is that even though I've highlighted some of those unique differences, and on the slide and in my what I've shared with you verbally, the context may be different for us working in physiotherapy, but the concepts are no different. And that's why we wanted to share with you some of the resources available for managing patient safety incidents. And as Ivana presents and as we continue our discussion today, I want you to think about the different teams that you work in, whether on a rehab team or a care team in the community or in a facility or other setting that you work in, an academic setting perhaps, and think about the resources that you have available to you. What is your workplace culture like? What is that leadership like, whether you're in a leadership role or you are supported by leadership? And what are your individual responsibilities related to patient safety and optimizing the safe care and safe outcomes of the patients and clients that you serve? So with that, I'm actually going to pass it over to Ivana to walk us through the concepts related to patient safety and incident management. Ivana?
Thanks, Sandy. That's great. I think you provided a great overview, and there is a lot of alignment between what Sandy talked about and what I will talk about. On this slide, I have a visual representation of the patient safety and incident management toolkit. It is based on a visual that we developed for the incident analysis framework. That's the inner circle, which represents incident management. Then encompassing it is patient safety management, which is all about prevention, and then the system factors. So I'm going to touch a little bit on all of them. But this toolkit where I pulled this information from for you is designed to provide practical strategies and resources for all three elements that I just mentioned. And what this toolkit does, it integrates a variety of resources that in the past, not a long past, used to be separate, like the Canadian Disclosure Guidelines, guidelines for informing and talking to the media when something goes wrong, and so on, in one place. So we will invite you and share the hyperlink to get to this toolkit for you. And what is important is that this resource is designed to be evergreen, meaning that we will continue to update it. Before I dive into it, I just want to give you a quick idea of how CPSI usually designs the resources, which is how we've done this one too. We have an expert panel, we call them faculty, that are guiding and helping us throughout the journey. We conduct a literature review, and in this case we had both peer review literature as well as gray literature, basically what's on public website. We also conduct focus groups to hear from the users of our resources, what they actually need. And then we, of course, base the resource on other publications that CPSI and partners have put together. So you may be wondering, looking at the chat box, I was wondering as I was preparing for the presentation, if you are going to ask me, was there a physio involved in the development of our resources? And the answer is Probably in the design, in our roundtable, there were some physio involved, but this toolkit, as well as all CPSI resources, are meant to fit the continuum. And just like Sandy mentioned in her last slide, the situation, the contributing factors for incidents and the way we prevent them is pretty much the same across all sectors. Now, what are the key principles to drive both patient safety and incident management? Our experts and the focus group participants, as well, the literature points to 4, and you will recognize them from Sandy's slide. It is the patient and family-centered care. The reason we chose our profession is to serve our patients. It is a privilege to be part of the patient care. Therefore, a key principle is to treat the patients with respect. Treat them as partners in their care because they do bring the expertise of their own disease. Second one is shared responsibility. Working in teams, it is the way healthcare works. Each of us has a big responsibility, and we are part of a big team. And actually, that teamwork, it is the best defense for patient safety incidents. So it needs to be fostered. Everybody who is part of the team is valued. They were hired to add value, so we need to treat them as experts in their own domain. And each team member should be empowered to speak up and to act if something isn't right. So I'm going to move to safety culture, which includes that speaking up element. The safety culture is the way we do things in an organization. It is the result of people's values and beliefs combined with the organizational structures and controls. That's how the behavior, the way we do things in a certain place, shapes up. So we all have to be committed to that safety culture, committed to prevent harm, to treat ourselves and the others in a just and fair way. And finally, the last principle is to keep a system perspective. What that means is understand that we as team members and care providers, we are part of a bigger system. When something goes wrong, it is definitely not about blaming and shaming. If it is, this will be treated separately outside of system improvement and patient safety. But for patient safety, we would like to focus on the factors that exist in the system and triggers, basically set up well-intended healthcare professionals to do something unexpected, do something that harms the patients. So keep in mind the system perspective and focus on that in order to make care safer. An additional word on patient safety culture, and the reason we wanted to talk about this a little bit more because it's really, really important. It is based on who you are and creating a social context for the profession. This is a quote from our former CEO, Hugh MacLeod, and I think this one captures it beautifully. I want to point to the fact that there are significant cultural differences between shifts and even team members. This has been demonstrated through research over and over again. There's a difference between the night shift and the day shift. There's a difference between there is a certain team working or there's other people in the team. The way I like to think about this is that old saying that when you send an honest person in jail and have that person surrounded by criminals, at the end, that person will become a criminal. So that's one example of how we culturalize ourselves when we go to work. So think about the young healthcare professionals that come out of school and get in real life situations. We need to make sure that we imprint in them the right culture, a safe culture, and encourage them to speak up. Because it is possible for one single person to change the culture. You probably heard about this. In preparing for this presentation, I looked at the website where all the webinars are recorded, and there was a webinar in November 2014 on quality improvement and patient safety, the Safety Net study. So Michael Westway and Sunita Volkra talked about patient safety culture. I would like to ask you to refer to that slide deck for more information. We don't want to repeat that here. Now, as part of incident management and patient safety management, there is an important setting the stage phase. We call that before the incident. To start, I wanted to re-emphasize the principles, right? Promote the teamwork, build capacity in everyone, have that safety culture exist. Also, before the incident, you need to monitor, analyze, and prioritize the issues that are identified. And here you can look at patient safety risks or contributing factors, as well as noting the strengths of the system, things that actually stop over and over and over again incidents from becoming worse. You may remember the Swiss cheese model from the presentation I just mentioned, where every person, every actor, every team member has the chance to stop things from from becoming worse. So there are things that always go well, so let's note them and make them even better. Then implementing actions that either mitigate risk or strengthen the system. And as a result, safety and quality will get better. What kind of actions, you may say? Well, those could be things that come out of the incident analysis. That could be things that your team member report as being a concern, like equipment that's not working properly. It could be quality improvement projects, like, let's say, infection prevention and control measures that are part of your organization. So implement and follow through on those things. And establish incident management structures. What are those things? Those are things like the reporting and learning system. They're places where you can always go for resources. There are also plans, processes, and resources that are available for everybody. Like, for example, you have the dry needling critical event management. That is one example of a resource, a plan, and a process that you can have in place so everybody's on the same page when something goes wrong. But those systems and structures cannot exist or work well without the leadership and staff support. If people don't buy and talk about this at your unit level, they will not survive, right? Culture is eating strategy is another thing that our CEO likes to talk about. So incident management is one component that I think it's at the core of patient safety. So basically it means how we respond when something goes wrong. I talked a little bit about the before the incident, and I'm going to talk a little bit about closing the loop at the end. But for incident management, you need to think, what is the immediate response? What are the first things that we need to do when something goes wrong? And again, those should be articulated in policies and procedures and be available for all staff. Usually it begins with caring for and supporting the patients and families. But also we need to care for and support the healthcare providers who are involved in an incident. It is extremely traumatic for a healthcare provider to be part of that conversation and to be part of that experience. So we need all to make sure that the second victim, that's how the providers are called when they're involved in an incident, the second victim is treated carefully. We need those people back at work as soon as possible. It also involves responding to the incident, securing any items like equipment or medication that was involved in an incident, and beginning the disclosure process. I'm going to talk a little bit more about disclosure because presenting to frontline people, I realize that that's one topic they really care about. So do you have any questions about disclosure? Type them in so we answer them when we get to that point. And take any action that's needed to reduce the risk of imminent recurrence. This may mean taking the equipment out of the unit or going around and telling people, hey, we have this issue, let's all be careful and watch for it. Then the next part of incident management is preparing for an incident analysis. The goal of an incident analysis is to identify the system issues and put additional safety system in place to make her safer. This is not about blaming and shaming. If that's an issue that is considered, usually that is analyzed in a different path, separate from the system review. Here you may have a preliminary investigation to understand what happened right away. Pick an analysis method. Yes, there's several ways to conduct an incident analysis. Put together a team to conduct the analysis and begin to coordinate and plan for meetings and interviews to understand all sides of the story. Then the analysis process begins, and there are a few things that are really important. First, understanding what happened. Usually the team builds a timeline to put together all the information from interviews and have the full storyline. Really important here is to make sure we interview the patients and family. Their side of the story is extremely important. And actually, I think it's the core story we all need to hear from. Then, through analysis, you determine how and why it happened and develop a set of recommended actions. The next phase is following through. Having a set of recommended actions is definitely not going to make the system safer. Implementing those actions and making sure that their implementation actually improves is key. So that is the follow-through phase. And finally is closing the loop, which basically means communicate back to those involved, to team members, to patients and families, what was found, as well as sharing the learning externally and internally so incidents like that do not happen again. So that is the cycle for incident management. And a few more words on disclosure. I don't see any questions from you on disclosure. You probably have this, you're comfortable with this. People think it is one of the hardest things that you will ever have to do. It is a moral, legal, and ethical obligation to disclose to patients and families when something goes wrong. Just think that you or your dear one had something unexpected happen, but nobody ever talks to you about it. Actually, you feel that there's a wall of silence between you as the patient and the care team. Nobody's looking you in the eye. This is extremely hurtful, and patients call that the second harm. So we harmed them once when we did not provide the care that what they were expecting, and then we hurt them one more time by not telling them that something is wrong. The Canadian Disclosure Guidelines is a great document to refer to. It will tell you when to disclose, what to disclose, and provide additional resources for that. I'm not going to dive into that topic too much because it could be the whole hour, but just want to tell you that disclosure is the right thing to do. There's legislation to support it, and it matters a lot for both patients as well as staff. The Canadian Disclosure Guideline will also help you articulate what to tell the patients during disclosure. Baseline is telling them the facts, no assumption or no guesses. It's as simple as that. But be careful, disclosure is not an opportunity for you to become a hero. Do not go into the patient room and start talking. Before doing that step, it is important to talk to the team, be on the same page with your team member, and make sure there is a plan and you follow the procedure articulated in your organization. So it is an important conversation, but it needs to be done right. Disclosure needs to take place as soon as possible, but not before the team is on the same page. I will tell you a quote that one of our patients told me actually it was during one of the focus groups for the incident management toolkit. She said, "We can't forgive them that our daughter died, but we cannot forgive them for how they treated us after she died." I believe this is really, really powerful and speaks to the patient's voice, and the patient needs to be informed. Sharing learning, it is the key element for both patient safety and incident management. Sharing learning is about closing the communication loop, telling the team involved in a patient safety incident, those are the care providers, telling the patients and families what was identified, what safety systems are in place, and how the system will be better. And through that, we are actually making the system safer. Sharing the learning doesn't always have to be about patient safety incidents. It can also be about patient safety successes, like near misses. A patient almost fell, but we caught her, or we had a system in place to prevent that fall. The communication between the team members at handover or transfer almost went wrong, but this is what we've done to make it better. So those success stories are probably as powerful as patient safety incident stories. Sharing the learning happens internally, meaning within the unit or the organization where the incident took place, but also externally. We want our experience to help prevent harm across the world. What we've learned at CPSI is that the same incident seems to be happening across the world. And to transfer the learning externally, we developed what is called the Global Patient Safety Alerts, which is a repository of alerts, advisories, and recommendations from across the world related to patient safety incident. And the final point on sharing learning is that it can be formal through the Global Patient Safety Alerts or a mechanism like that, but it can also be informal. Talk to your colleagues at the water cooler, share a story, and transfer learning that way too. That could be as powerful as the formal knowledge transfer. Finally, in the toolkit, we felt that it's really important to put the toolkit, incident management and patient safety management, in perspective by pointing to the system factors. And this is a slide just taking a visual that shows the system factors. And they are, of course, within the organization and outside of the organization. The licensing organizations that provide licensing practice to physiotherapists and the insurance, those are part of the system too. And they are influenced and they influence both patient safety and incident management. So what can you do is understand where you sit in the big picture within the system, respond to the system factors, align with requirements or accreditation needs. You can leverage the system factors to your benefit by working with your colleagues, for example, and of course collaborate. Collaboration is key. It is the teamwork at system level, the way I like to think about it. The tools and resources that the Canadian Patient Safety Institute creates are usually the foundation for toolkits that are adapted to different sectors. So we looked at the critical event management plans, which is one of the tools from Physiotherapy Alberta, and we recognize that it has so many of the elements from the Canadian Incident Analysis Framework and the Incident Management Toolkit. So they are adapted by experts in physiotherapy, and we do recommend that you pay attention to that. I'm going to look through the chat box now, and while I do that, I would like to ask you about resources related to patient safety and incident management that you use right now or you may need. I'm going to pause for just a minute and encourage you to type in the chat box, because we definitely do not have all the answers. You have the answers for your colleagues. It is our way to support knowledge transfer internally. Leanne asked about talking about apology legislation, the Evidence Act, and Sandy already responded. So Sandy, it may be better if you provide a verbal response. I think you are the best person to take that question.
Great, thanks, Eva. So I've just typed in some of the comments of the interpretation of Alberta's Evidence Act, and Leanne typed in that question when we were specifically talking about disclosure. And disclosure and apology are linked. So when something goes wrong and we provide that patient and their family members an apology, so when we let them know that something went wrong, certainly with that, when we're describing how we really didn't intend for that wrong thing to happen to that patient, obviously a natural human element is to provide an apology. And under Alberta's Evidence Act, you're actually protected when you provide an apology in a healthcare context. When you provide that apology, it really doesn't constitute negligence, to use that terminology. It's an expression of regret, simply. It doesn't imply any fault. It doesn't implicate you in any liability concerns in connection with that incident that you are providing that apology for. So just wanted to provide you that little bit of context in relation to some of the legislative concerns related to apology and disclosure.
I'm going to add a little comment from the literature. In United States, when they started to talk about disclosure and apology, there was a huge concern that the number of lawsuits will increase significantly now that healthcare providers will be able to say, I'm sorry this happened to you. And of course, the researcher pays close attention. And what happened is actually no additional, or the number of the lawsuits did not increase as expected. Actually, it stayed the same or even decreased. The explanation for that is that the patients just want to know what happened to them. If they don't know what happened to them or what the system is doing to make it to become safer, that's when patients consider going into a lawsuit. And we heard it over and over again from our patients, the Patients for Patient Safety Canada group Sandy mentioned earlier. They only want to know what happened and what is being done.
It's Sandy again. One other resource I'd like to highlight for you specifically for physiotherapy is the CPA. So the Canadian Physiotherapy Association has been releasing some wonderful risk management practice resources, and earlier this year they released one around apology and disclosure, and it's entitled Why Being a Professional Means Knowing When to Say You're Sorry. It describes a summary of some of these key principles related to disclosure, and including the Canadian disclosure guidelines that we're referencing. And it also provides that link back to our own profession around apology and disclosure. So that's available for us on the CPA website if you are interested. And there's a slide a little bit later on in the presentation that will remind you of that again.
Okay, great. I see no additional questions, so I'll move on for a few words on patients as partners. And the reason I felt I'm going to have 2 slides on this is because there are so many system changes that you probably noticed in our society that now encourage and empower us to treat patients as partners. And patient-centered care is one term that is used to define that, and it means that we treat patients and families with respect. We inform them and engage them in conversations related to their care. We empower them to take control of their own care. The system changes are all over, and I want to point to just some of you. For example, technology. There's so many apps now, like this one on physiotherapy, to help patients. There are apps to help patients keep track of their health. There is the Apple Watch, of course, and Apple Health suite of products where you can track data about yourself in a way that it wasn't possible until a few years ago. There's also system changes in the society. We as citizens are empowered to take control of so many things. Just think of the grocery lines checkout. Now there is self-check. We don't have to go through the other option. But we do have the other option if we feel like it. When we fly, we do online check-in. We may not even talk to any staff at the airport. So that's a huge shift. And as a result of that, we are as citizens expect to take control of our own health too. There's also many healthcare campaigns, like this one is called Ask Me 3. And there are similar campaigns from the Canadian Patient Safety Institute, where patients are encouraged to prepare when they go to their healthcare professionals and to have questions. The questions for Ask Me 3 are, what is my main problem? What do I need to do? And why is it important for me to do this? And I believe that why is important for me to do this is a very powerful question, because when it comes to physio, patients really need to understand why they need to do a certain set of exercises over and over again, and why some exercises can be adapted and others cannot. So this shift in society and the increased awareness that patients should take control of their own health and the availability of tools like apps and campaigns will continue to put pressure on all of us as care providers to make sure that care is patient-centered. But does this work? Are those campaigns actually helping? And yes, indeed, the results show that patient adherence to the plan of care, especially for chronic conditions, is indeed better. And as a result, the health of people and society is better. And also, there are savings towards the healthcare system. So indeed, patient-centered care is not going to go anywhere. It will stay here. So it's our job as healthcare providers to embrace it and help patients set their own goals and take an active role in their own care. Patient engagement is a concept slightly different than patient-centered care. Patient-centered care happens at the front line. Patient engagement is a concept where you have former patients called patient advisors help develop education programs, policies, make decisions, design and implement projects. So patient engagement is one way to make sure that the processes of your organization and the services you offer in your clinic are indeed patient-centered. This just means listening to the patient voice. Here at CPSI, we worked with Patients for Patient Safety Canada. Our members were asked to help develop policies by the Ontario Physiotherapy Association, but there are patients within the province of Alberta with Alberta Health Services. There's many resources for you to tap into when your organization is ready to include the patient voice. Don't hesitate to contact us. We'll be happy to connect you with the appropriate patients and families if you need to. So we are at the end of our presentation. I will talk a little bit about this slide, which I stole from the Canadian Association of Pediatric Health Centers. They had a symposium on patient safety a few days ago, and they basically built it around the idea of that everything we need to know about patient safety, we already know. We've already done it. And that there are very simple things that help us to be good team members, to be fair, to be team builders, to be caring and patient-centered. Sandy, I'll turn it over to you for a few final comments now.
Great, thank you so much, Ioana. And with the fun image on the screen, we certainly didn't want to oversimplify any of the concepts that we've provided to you, but we wanted to, really reinforce that patient safety is really everybody's responsibility. Some of it does come down to some of the common sense, things like using best evidence and our best clinical judgment, staying current with best evidence and applying those concepts, using good team dynamics. So even things like saying please and thank you. We always ask for informed consent. That's drilled into our practice regimen, and certainly something that is an expectation to ask for informed consent. But even we should consider disclosure and apology, very similar to how we view informed consent. So when something doesn't go exactly right, whether there is an unsafe outcome or something happens as a result of our care or our care plan, or something potentially could have happened, we should be sharing that concern with the patient and perhaps even talking through some of the options for preventing some of those occurrences to happen again. Probably one of the best things on here is cleaning up after yourself when something does go wrong. How are we responding to that? We wanted to highlight some of the activities and best practices related to incident management, even things like appropriate hand hygiene. Infections are a big concern, and transmission of preventable healthcare associated infections are a concern in different practice settings that physiotherapists work in. So using best evidence when we're practicing infection prevention and control. And again, Physiotherapy Alberta has got some wonderful resources for us as physiotherapists on the website. So in summary, as I said, patient safety is really everyone's responsibility, and hopefully through some of the examples or experiences that we've shared with you and highlighted today, you'll see your role in patient safety as a clinician, as a leader, as an administrator, as even as a patient and family and caregiver yourself. And really getting a good understanding of what patient safety means, it's about optimizing the quality of our care, is really that first step towards improvement. We've highlighted a few Physiotherapy Alberta resources, but here's another really great one that Leanne and her colleagues were able to prepare for all of us. That was released earlier this year as well. So maybe if you can show by raising your hand online if any of you have watched this video on Physiotherapy Alberta's website. Hopefully some of you have seen it, and if you haven't raised your hand to say you've watched the video, then certainly this is, again, on Physiotherapy Alberta's website. It provides a nice overview about patient safety, and again, provides it in that context for physiotherapy. And we've also highlighted some of the other resources, specifically the critical event management plans, and Leanne has posted the link in the chat box for your reference. Certainly, of course, we know our practice standards for physical therapists on our website as well, and many of them relate to our role in patient safety. I also previously mentioned the CPA's risk management practice resource related to apology. Again, it's available on CPA's website, and I encourage you to have a look at it. It provides some wonderful explanation about our role in apology and disclosure. A couple other things available on the CPA's website, certainly our essential competency profile. There's many elements related to patient safety and our role in patient safety, and some of the different roles described, particularly our professional competency profiles, our manager and communicator. So as you're doing your annual professional development, consider some of those aspects of your professional role as a physiotherapist. And despite what care setting that you work in or practice that area that you work in, certainly there are some ongoing opportunities to continue to stay aware of and current with the best patient safety and quality improvement evidence and science. Way back in 2007, the CPA also released a position statement on patient safety. It's a little bit outdated with some of the terminology now, but certainly it's a good reference document as well. So again, position statements issued by our national association certainly describe our role in patient safety, and certainly the CPA felt strongly enough about making patient safety a priority and across all of the professions across the country. So any other questions, please feel free to continue to type them into the chat box, any questions, comments, and again, we'll be happy to follow up with you after the presentation. One thing I mentioned earlier is we want to encourage you to celebrate Canadian Patient Safety Week, which is actually just around the corner next week. So a national proclaimed week by Health Canada. We've been celebrating it for many years across the country. If you join us at asklistentalk.ca is the website where you can access different types of resources, bring the awareness about patient safety into your own practice setting or wherever you work, whether community or academic, etc. We have packages available that are include a poster campaign. So what I've included up on the screen is some of this year's poster campaign, wonderful creative elements and great posters that you can keep up, not just during the week, but certainly throughout the year. The theme of Canadian Patient Safety Week is good communication is good for your health. And some of the images up on the screen, like good nutrition or companionship and exercise are good for your health. Good communication is also good for your health. And this relates to that overarching theme of Ask, Listen, Talk, which again is our mantra. You can join the Twitter conversation at Ask, Listen, Talk with the hashtag on your screen. During Canadian Patient Safety Week, we also are distinctly privileged to host Canada's virtual forum on patient safety and quality improvement. So if you're inspired to learn more about patient safety and quality improvement across different aspects of patient safety, we host an international virtual conference for every day during October 28th through 30th. 4 or 5 hours of virtual programming, which you can log into from any computer with an audio device and watch patient safety experts from across the globe, hosted here in Canada, and actually we'll be broadcasting right from Edmonton. at the ATB Arts Barns just off White Avenue if you're able to join us even in person. So if you're interested in joining that free virtual conference, in-person seats are just $20 a day. That's an opportunity for you as well. If you're not able to join us next week, or if you're interested in sessions from previous years, all of our presentations are available for free download on our website as well. Lots of great resources, and just directs you to asklet'sandtalk.ca or CPSI's website, patientsafetyinstitute.ca. One other thing I'll just on a personal note I'll also highlight for you that's happening next week is the Canadian Physiotherapy Association's Shop Talk blog. Great new resource available to anybody. I don't even have to be a CPA member, but encourage you to do so. They're starting a discussion around quality physiotherapy. So quality PT and what it means to provide quality PT. And they focused around the different dimensions of quality. And they wanted to start with safety. So kudos to the CPA for starting to celebrate Canadian Patient Safety Week with stimulating discussion around how safety fits into quality PT. And so I was privileged and honored to be asked to provide a blog article, which will be posted on Shop Talk next Wednesday. So join the conversation. It's the hashtag there is hashtag is Quality PT, and certainly ask, listen, talk to celebrate Canadian Patient Safety Week. So if you're interested in a little bit more about patient safety and how it relates to PT, I encourage you to join that dialogue. Any other questions? I haven't seen anything else come through the chat box, but certainly feel free to enter any other final concluding comments, questions, thoughts.
So as we give the audience a chance to type in any last burning questions, Sandy, I have a question for you that came to mind as we were talking about the second victim. You know, I think back to my time when I was a supervising therapist and had a team that I worked with, you know, and have you got any really practical rubber meets the road kind of tips for when you encounter that second victim and how to support them appropriately, or things to avoid that, you know, you think intuitively you should say, but maybe they're not actually helpful? Can you give us any insight into that?
Yeah, absolutely. So certainly with your incident management resources, as Ivana's mentioned, after the incident, there's things that you need to do to obviously support that patient and family member and put things in place to prevent that harm from occurring to anybody else as immediately as you can. But certainly there's things that you need to do to provide that support to the patient or the providers and anybody else that might have been involved. So again, if there's things like employee assistance programs that your staff might be available to you or to your staff, that's certainly things that you can follow up with that are immediate and available to you. We also have some other ideas, again, available in the resources related to the Canadian Disclosure Guidelines in the Incident Analysis Framework. If you're just interested in this from a practical aspect as well, or from a learning opportunity, just a few months ago we hosted a webinar about helping helpers heal. And that webinar recording is also available on our website for free download for an education aspect or just for your personal interest. This year, also during Canada's virtual forum on patient safety and quality improvement next week, we have over the years, we provided several patient videos describing their patient experiences with harm. But this year, we also wanted to provide a focus on second victim. And so we have prepared some provider videos where providers and leaders have shared their experiences of how they were affected by harm from healthcare and experiences they might have been through related to patient safety incidents. So I encourage you all to check that out. They're wonderful videos from some wonderful experts, and certainly you'll all relate to those experiences.
I have added a link to the resources from the Canadian Incident Analysis Toolkit for you. You will find some from Alberta Health Services and some from US that are really practical things, like you said, when the rubber hits the road. But the baseline from research is that second victims benefit from the most from talking to peers rather than people higher up in the system. That seems to be having the biggest impact. So help each other out through this. Help each other prepare for patient safety incidents is really important. Even things like, you know, a pat on the shoulder and asking, how are you, instead of that wall of silence, because there is a risk of having the individual involved in the incident being stigmatized. So we obviously don't want that to happen. So even simple things like that, how are you? Do you want to go for a cup of coffee or a walk? Are really important to help heal.
Thanks,
Ioana. And again, this really reinforces that oftentimes when something does go wrong, it's not just an oops. As I mentioned earlier, that it can happen to any of us. It can and will happen to any of us. We'll all be affected by patient safety incidents at some point in our career, either as a professional or even as a patient and caregiver ourselves.
Thanks very much, Sandy and Ioana. I see that we have one person just typing a final comment or question, so I'll comment thanking you for your presentation and for sharing all these resources. So it is now 9 o'clock, so I think we will wrap up today's meeting, but I wanted to say thank you again to Sandy and Ioana for your presentation. It was a very interesting and engaging conversation, and I appreciate you pulling together all the different pieces that support us in addressing patient safety incidents and trying to manage them appropriately. So thank you very much